Hello and greeting to all. We are Team 10 and we are presenting a case study titled Delivering Free Healthcare in Pakistan's Indus Hospital, Creating a New Generation of Healthcare Leaders. Our presentation is consists of an introduction, summary, background of the case, analysis which further includes the problem of the case, the solution and the future recommendation, conclusion and then the references. Our case study is based on Pakistan's healthcare delivery system. Despite of the fundamental right to healthcare, the country struggles with inadequate medical facilities and the lack of medical professionals. In these worsening conditions, Abdul Bari Khan and other co-founders of Indus Hospital had set out to improve the health of Pakistan's poorest patients. In 2007, the Indus Hospital was opened with the mission of providing exceptional care without any exception at no cost. The Islamic Republic of Pakistan is located in South Asia and is bordered by Iran, Afghanistan, China, and India. The country is divided into five provinces, namely Khyber Pakhtunkhwa, Punjab, Sindh, Balochistan, Gilgit-Baltistan. Islamabad is the capital city of the country. The modern state of Pakistan developed in 1947 when the Indian subcontinent was partitioned into two nations following the independence from the British rule. Indus Hospital was a non-profit private charity hospital that opened in July 2007 to serve a catchment area of about 2.5 million people. The hospital was in Korangi, a poor and under-deserved Karachi neighborhood where multi-generational families crammed into small flats stacked unevenly along the unpaved narrow streets. The five-story 150-bed Indus Hospital was the tallest building for miles. Indus's 20-acre campus also included a walk-in filter clinic, an open-air TB clinic, a pharmacy, and a nursing school. So, in 1980s, a group of medical students at Doe Medical College in Karachi formed an organization called the Patients Welfare Association to raise funds for the poor patients at Civil Hospital. After 20 years, in 2007, Indus Hospital was established with 150 beds and treated its first patient. This led to the Indus leaders created the Indus Hospital Research Center in 2010. In 2012, the hospital developed staff training programs based on internally created standard operating procedures. During the period of 2009 and 2015, Indus's TB program expanded a network of 11 treatment sites in two provinces for 500 patients. Indus Hospital plays a pivotal role in shaping the success and effectiveness of an organization. The organizational culture at Indus Hospital is comprised of a positive patient-centered organizational culture. Employee satisfaction and engagement is an important factor as well. Promoting continuous learning and innovation is another factor that is maintained at the hospital, and they continuously accept the challenges in shaping organizational culture. In the context of healthcare, a hospital's organization culture encompasses its shared values, beliefs, norms, and behaviors that defines its identity and guide the action of its staff. The further presentation will be carried out by one of my team members.
As a low to middle income country, Pakistan's average income was low. The poverty rate, which means earning less than $1 per day, was 22.4%. There was a lack of basic healthcare infrastructure like clean water supply, which only covers 90% of the country. Poor sanitation hygiene, less than one-third of pregnant women receive antenatal care. And there was no universal vaccination coverage. The morbidity and mortality rate were high in Pakistan, especially in rural areas. At the same time, public healthcare service agents like hospitals and clinics were performing far below standard. Many complaints about the lack of staff and the inconvenient locations of the healthcare facilities. Therefore, more than 70% of the population was forced to seek fee-based, rarely regulated private healthcare services. The poor people were driven further into poverty as they had to pay out of their own pocket, even though the services they received may have questions in quality and integrity. Charity medical care was usually not provided quality service to. That drove most people in rural areas to rely on traditional healers. Change in the government interrupts the leadership and policies that were laid down by the previous term that hampered accountability and continuity, which dampened morale and wasted the already limited resources. Pakistan spent very low on healthcare. It was 4% compared with the military spending at 18%. The government doctor's salary could be as low as a quarter of those the private sector offered. It was estimated that about 20% of doctors emigrate overseas annually. Therefore, there was always a shortage of healthcare staff, especially nurses. At the same time, paramedical staff were not included in the government budget, so there was a lack of training and standardization. In public healthcare, service providers were infamous for their lack of female staff, accountability, and performance recognition, coupled with the widespread accusation of corruption, making the service poor. Since the health insurance concept was unpopular, poor people had to pay private medical providers by selling their already limited assets or getting into debt in order to receive better services. Yet there was little regulation by the government. At the same time, while people like those in Indus hospital wanted to advocate preventive health care, the general public still put the primary care burden on the government's shoulders, including the donors.
In this section, we will explore the available options and evaluate each option based on its potential benefits and limitations. The first option is diversify funding resources. Diversifying financing resources can increase financial stability by reducing dependence on a single channel. A wide range of resources and potential partnerships are made possible, but diversifying financing may need time and effort. And creating and maintaining new relationships may provide difficulties. Also, one of the funding resource is a fee-for-service model that may raise concerns about maintaining the core value of free healthcare and its potential impact on the organization's mission. The next option is a strength philanthropic support. Building a strong philanthropic support can provide a consistent with the hospital's goal, but relying primarily on philanthropic financing may be exposed to changes in a donor contributions and other risks. There may be limitation on the availability and consistency of donations. And the next option is enhance operational effectiveness. Improving operational effectiveness can optimize resource allocation, streamline process, and improve overall efficiency. It may save costs and improve patient care. But without new financial sources, improving operational performance would not be sufficient to find a lasting solution. It may require significant investments in technology and process improvement. Based on the case study, the Indus Hospital ultimately decided to rely mostly on philanthropic support to keep providing free healthcare service. To maintain financial sustainability and support its expansion goals, the hospital concentrated on growing its network of donors, nationally and internationally. The hospital's mission of offering free healthcare service is supported by the choice to give priority to charitable donations. By interacting with donors, the organization can obtain the funding to continue operating and growing. However, this solution may still present challenges in terms of financial stability and long-term sustainability because relying only on the charity can be unpredictable, and there may be restrictions on the availability and consistency of donations. The solution chosen by the Indus Hospital demonstrates the importance of aligning organizational strategies with the core value and mission of the institution. The Indus Hospital is committed to achieving results, one of the lead's framework domains. They set strategic goals to address healthcare disparities and improve patient care. They guarantee the long-term viability of their free healthcare services by making efficient use of resources and exhibiting financial responsibility. The hospitals focus on philanthropic support and providing free healthcare services demonstrate its commitment to social well-being and addressing healthcare disparities. Developing coalition is another area of the strength for the Indus Hospital collaboration between the Indus Hospital and donors, government, and other healthcare organizations is an example of the necessity for strong partnerships to promote healthcare delivery and guarantee financial sustainability. Effective stakeholder engagement can help mobilize resources, foster collaboration, and strengthen the overall healthcare ecosystem.
Hello everyone, good evening. This is Avni from the group and I'll take this topic further. I'll talk about the issues to be addressed in the healthcare delivery by Indus Hospital in Pakistan. I'll talk about the new advances or variable techniques that could be used to address these issues, future recommendations or proposals to address them differently and provide a probable solution, and also I will conclude in the end. So initially, let's talk about what are the healthcare issues that Indus Hospital faces in Pakistan. So there are limited access to healthcare, inadequate healthcare funding, low health insurance coverage, quality of healthcare services is poor, high diseases burden in the area, maternal healthcare of the child is affected, there are inadequate distribution of healthcare resources in the entire area, and healthcare awareness and education lacks quite a lot in the natives of the area. Now, how do we address these issues? So the first thing would be infrastructure strengthening. For any organization, it is the best to have a good infrastructure. So they should be allocating the resources to improve and expand the infrastructure of the hospitals, including all facilities, medical equipments, and newer technologies. This will finally enable the hospital to provide a wide range of services and it will help accommodate a large number of patients. The next is human resources development. To invest in the recruitment and the training of healthcare professionals, let it be doctors, nurses, and support staff, everyone. Continuous professional development programs can be run to help them improve their skills and knowledge, and this will help in leading to a better patient care. The next is enhanced access to healthcare services. Now, implementing some strategies that will improve access to healthcare services. It could include establishment of satellite clinics or any other outreach programs in the areas which are undeserved for the patients to be able to have more facilities for them who are not getting all these access to healthcare facilities in their own areas. The next is community engagement. So fostering partnerships and local communities, along with them, the hospital and the organization should work to promote healthcare awareness and preventive measures in the people in the area. Conduct good healthcare education programs, community outreach events, and campaigns to raise awareness about the diseases, hygiene practices, and the importance of seeking timely medical care. The next is collaborations and partnership. Now, everyone should foster in partnerships with national and international healthcare organizations, some academic institutions, and research centers. These collaborations will further facilitate knowledge exchange, it will help capacity building, and it will provide good access to resources and a nice expertise. Next is sustainable funding. Now, the organization should establish some long-term funding mechanisms so that they ensure good financial sustainability of the hospital for a long term. This will involve seeking support from all the government funding, from some corporate sponsors, from philanthropic organizations, and also the individual donors as well. Financial assistance office is of prime importance when it comes to any big healthcare organization. The next is research and innovation. To be stagnant at a place does not make you develop at all. Therefore, promoting researches and innovations within the hospital to address local healthcare challenges is of really important. It could lead to the development of new treatment protocols and improved healthcare practices and advancements in the medical technology. The last is monitoring and evaluation. Now, once you are done with all this, you need to implement robust monitoring and evaluation systems to assess the hospital's performance. They would also track the key indicators and identify the areas for improvement. Regular audits and feedback mechanisms are necessary to help maintain quality standards and ensure accountability in the hospital and for their services. Next is, how do we develop newer techniques or innovative techniques in this hospital to address the healthcare challenges? The first is public-private partnerships. Now, we develop few good partnerships. We foster them with private healthcare providers and pharmaceutical companies. These collaborations with the private entities, they will help leverage additional resources, they will build good expertise and innovative solutions to improve the healthcare services in the hospital. The next is telemedicine services. Nowadays, everywhere telemedicine has been taking a good effect because it is the time or the era of technology. So implementing telemedicine services, it will enhance access to healthcare, particularly for those patients who live in the remote areas or undeserved areas. Utilizing the technology, these patients can consult with healthcare professionals remotely, so they don't need to travel all the way. This will thus reduce the need for physical visits and it will increase their convenience a lot. The next is mobile clinics. So establishment of mini clinics or mobile clinics, that is said, that can travel to different remote areas, especially again in the undeserved communities. These clinics will provide primary healthcare services in the area. It will improve the preventive care and healthcare education, ensuring that healthcare reaches to those who face geographical barriers. The next is volunteering programs. It is always good to develop a robust volunteer program to engage healthcare professionals and other volunteers to be able to provide financial protection and affordability. It is very important for them to have these volunteer programs where all the patients would be outreaching for all kind of medical emergencies and facilities. Next is healthcare financing schemes. Now, introduction of good healthcare financing schemes such as microinsurance or community-based healthcare financing to improve health financial protections and affordability for all patients. This will involve partnerships with insurance companies or any community-based organizations to develop customized health financing solutions for the patients. The next is enhanced health information systems. Now, what do you mean by enhancing health information systems? In that, when you try or you are stagnant at a place, you need to develop comprehensive health literatory programs which will target patients and the community. These programs will focus on educating individuals about common diseases, about the preventive measures, and importance of early healthcare seeking behaviors, empowering them to make informed decisions about their own health. The next is collaborations and partnerships. Now, academic institutions play a major role. So, forging collaborations with medical universities and colleges to establish training programs and rotations for medical students and residents to go into the rural areas or undeserved communities. This will help address the shortage of healthcare professionals in the area, providing valuable learning opportunities for students and to create a pipeline of skilled healthcare workers in the community. The next is sustainable funding. Now, every hospital or every financial scheme needs to introduce good finances such as microinsurance or community-based health funding, as we discussed. So it is a necessity to develop good research and sustainable funding which will last for long term in these hospitals. Next is research and innovation. For every organization, it is important that they have good research collaboration with academic institutions and other research organizations that will conduct studies on local healthcare challenges. This can lead to evidence-based interventions and policies, thus contributing to improve the healthcare practices and patient outcomes. The next part is monitoring and evaluation. Now, monitoring the patient data and the databases to evaluate the current and past healthcare development and the current scenarios that will all help in the audits and improve in the and lead to improvement of where the hospital lags. The next topic that I would like to cover is recommendations or proposals that I'll make to address these issues differently and provide a probable solution. Now, a few steps can be taken, like motivating and equipping the group to improve healthcare. Next is we can encourage a collaborative and compassionate work environment between all the communities, local communities, the government, healthcare sectors, providers, and bigger organizations as well. We can encourage active enforcement of the workforce and to involve their ideas and skills and contributions. So this will improve. This will include all the research-based groups, the private practitioners, the local communities, and the welfare programs, including non-government organizations as well. We have to get patient-centered care first. That means healthcare has to be given a prime importance. Not just the healthcare professionals, the patients need to know this. So community outreach programs are going to help in this. Let patients know that healthcare is their right and a necessity. We have to create a very friendly and polite environment at the workplace. Usually, it is seen that in underdeveloped or developing countries, there is a hierarchical organization. So, at that place, what happens is there's no friendly environment. Patients do not take this very well, and also, not all healthcare professionals are comfortable working in the same environment. So, providing an environment which is very polite and friendly is a must. Next, we have to create and make some professional developments in the and investment such that when educational systems and healthcare organizations they work together, it is going to build a better community in terms of good disease-free environment and definitely a better sector. Next is providing tools and resources that are required for delivery of high quality healthcare. That is development of newer techniques, research-based organizations, and all those community welfare programs that are being run currently in the developed countries could also be incorporated in such places like Indus Hospital that will help in the outreach of the patients. To sum up these recommendations or proposals, I would like to say that investment in recruitment and training is important. There has to be good fostering of partnership with local communities to provide healthcare awareness programs. There have to be efficient electronic healthcare record keeping and information systems to be able to present and maintain patient data. We have to foster the collaboration between the national and international organizations and research centers. Establish a good long-term funding mechanisms to ensure financial sustainability, explore alternative solutions to private-public partnerships, and telemedicine services are required. Also, there has to be a cultivation of good culture of continuous quality improvement. As a transformational servant leader in a hospital in Pakistan, I would like to bring about a positive change and improve healthcare status by inspiring and empowering my team, fostering a culture of collaboration, empathy, and continuous learning, encouraging members to actively contribute their ideas and expertise. Lead by example, that is, demonstrate a deep commitment to serving patients and the community. Prioritize patient-centered care. Ensure that every decision and action that aligns with best interest of the patients. Promote a supportive and inclusive environment where each team will feel and valued and it will feel motivated to excel in themselves. Encourage innovation. invest in personal development and professional development, and also provide resources that enable staff to deliver high quality patient services healthcare. By cultivating a transformational and servant leadership approach, we can inspire by team to work together, embrace changes, and drive meaningfully improvements in the healthcare organization over there. To conclude, I would like to address the healthcare issues in Pakistan, which require multifaceted approach. It involves stakeholders in all the different hierarchical systems. Improving healthcare delivery entails strengthening infrastructure, enhancing access to services, prioritizing quality care, and promotion education. The Indus Hospital, as a renowned healthcare institution, can play a pivotal role in advancing these goals. By investing in infrastructure and human resources, engaging community, fostering collaborations, and implementing innovative solutions, Indus Hospital can make a significant impact on the healthcare outcomes. Additionally, by embracing transformational servant leadership, healthcare leaders can inspire their teams, they can promote patient-centered care, and drive positive change in the healthcare system. Through sustained efforts and collective actions, the hospital and similar institutions can contribute to an improved healthcare landscape in Pakistan, thus ensuring better access, quality, and outcomes for all the give and catchy system for this. I would like to give a proposal of concern for additional considerations. So the takeaway question would be, how can the implementation of telemedicine services at Indus Hospital in Pakistan effectively address the accessibility barriers faced by patients in remote and undeserved areas? Taking into consideration all the healthcare and telemedicine services that are being run all over the world now, especially after COVID, how will these benefit the Indus Hospital and in Pakistan and all the other areas and all the other healthcare institutions, provided that we have seen a lot in this case study? That will be my further takeaway approach for this. Thank you everyone for watching the video. I hope that gives a good insight of the case study on this hospital, and we'll be ready for any questions that you have further on your way. You can post it on the YouTube comments section. Thank you for watching the video.